This is Dr. Kathy Backus. We are here today with a young 2-year-old Mustang off of the BLM land. This is a wild horse that is just barely 2. We can tell from his teeth. These are baby teeth here. These are adult teeth here. This is most likely, BLM does a really good job, but they don't do dentals on their babies. But it's very, very important to, as your teeth are erupting, instead of having an orthodontist, to have a veterinarian balance your teeth and the alignment when you're a baby. If you wonder, you go, well, why would you worry about a baby? They're just going to lose their teeth. Why would you actually file them down? And this is not about filing them down. This is about getting very good balanced alignment, so this baby will have a proper proprioceptive input from his teeth. So it's actually called dental equilibration, and it's based upon science that we have learned. This baby's bottom tooth, that's the adult tooth, is a little bit behind the upper tooth, so this guy doesn't quite match, which makes it hard to pick things up, right, if you don't have teeth that come together. Not that he's thin, he definitely manages, but it makes a big difference on how you develop as an athlete and your whole balance in the world. So that's the overview basics of dental equilibration. Then you also check and just make sure the teeth are healthy, right? That they're not being broken or falling down. Falling out, I should say. Falling down is what the horse does. All right, and we're so kind because you could actually have a headstand that we put his head on, but we forgot it today. So Misha, Misha gets to be the holder of the head, which is a lot of work, but the other way about it. So that is pretty good as far as just the little touches. Baby teeth are soft, right? So you don't need much of the power tool. I'm going to go ahead and have you take your hand out. So what we're trying to illustrate, which you guys may or may not be able to see, when these teeth come together, the angle should come up to the corner of his eye. And that's how you are, it's almost like an art to it as well, just to kind of see the bite in the correct angle, as well as being correct side to side, so he's not like boop, boop, you know, or anything like that. And that's what's really important about getting babies' teeth lined up. So he does that. So if I literally put a credit card in here and the credit card was sticking out, it would aim right up to the back corner of that eye, which it does, which is good. So that is a good thing. We give him a little rinse without getting the cord wet. It's a lot of tricky equipment. I guess that's the other thing to mention is when you get into doing this, it definitely requires a lot of equipment. So there you go. That's our good, don't want to like hit you with the light because it's real bright. That's our first little segment for Baby Mustang getting teeth lined up when you're just new to the world.